Hello, my name is Mark Tompkins, and I'm the Director of San Juan County Health and Community Services. Our department, in conjunction with the Department of Emergency Management, has been leading the county's COVID response efforts since the beginning, though we've had a tremendous amount of help from many organizations, volunteers, businesses, and other county staff throughout. As hard as this has been, every day we are grateful for our community and the way the Islanders are pulling together. I want to take a bit of time to answer some common questions and talk about our department's efforts to deliver vaccine to the islands. I have a list of some of the most common questions and will be answering as best I can. It hasn't been easy, but we are making progress. Our biggest challenge is a lack of vaccine to administer, including a lack of clarity about how much vaccine will be coming to the county each week. Given the complexity of the allocation and the ordering process, developing and rolling out the local effort has been no small task. But here's where we are. Beginning in the last week of December, we started vaccinating on San Juan, Orcas, and Lopez Islands, with vaccine events scheduled on each island each week. Initially, we focused on and vaccinated those eligible in Phase 1A. This includes healthcare staff, emergency responders, long-term care staff, and long-term care residents. On January 20th, we began immunizing those eligible under Phase 1B, Tier 1, which includes people 65 years and older. To date, we've administered over 800 Moderna vaccines countywide. Second doses are underway with the healthcare professionals who are the earliest individuals to be vaccinated in the islands. At this point, we are confident that we're going to be able to get any vaccine we receive into an islander's arm within 1 week of receiving the shipment. We have a plan to be able to deliver 1,000 doses a week, but unfortunately, we don't anticipate receiving anything close to that much vaccine anytime soon. Now, some of the most commonly asked questions. The biggest roadblock is available supply. We know that it feels agonizingly slow to anyone who is waiting for the vaccine. But we are asking everyone to be patient and understand that we are ready to move quickly as soon as vaccine arrives. Please know that we continue to request additional doses weekly and are advocating at the state level on behalf of our residents. So just as with any vaccination effort, the intent is for our local healthcare partners to play a vital role in helping protect our communities. Local healthcare providers and pharmacies are in various stages of the approval process. Some are approved and are simply waiting supply. Others have submitted their application, but are not yet approved yet. And still others are working on their application. Our team has been working with these local providers to ensure their applications can be submitted and approved in a timely fashion. We are working with those providers to ensure they can safely receive and administer vaccine. Once approved, providers will be able to secure their own vaccine supplies through the State Department of Health and will be scheduling appointments through their own scheduling systems. In some cases, we may move our vaccine to a provider who has capacity to deliver the vaccines, but are lacking the doses to do so. At this point, I would like to give a huge thanks and a shout out to the Lopez Island Pharmacy, who became the first provider, other than San Juan County, to provide vaccine to those within the Phase 1B Tier 1 population. And to date, they have immunized over 200 Lopez residents, and that was in the month of January alone. Our expectation is that other providers will soon follow suit, and we'll be there to support them as needed. It really is a team effort with all of us working together. Once all providers are up and running, it will greatly increase the access to vaccine to everyone here in the islands. Like most everyone, we realize that our online registration system has its challenges and acknowledge the frustrations among many community members. The system is frustrating and in most cases is leading to someone not being able to schedule an appointment, primarily due to the fact that we have very limited supply and very limited appointment slots available. Again, the biggest issue is the lack of available vaccine supplies. Rest assured, as we receive confirmation that we'll be receiving vaccine, we release the appointment slots for the doses, but only when we are sure we will have the vaccine on hand. This is to ensure that we don't have to cancel appointments due to vaccine not arriving. Also understand, there are over 5,000 San Juan County residents over the age of 65, all of whom are eligible to receive the vaccine. Our supply has been measured in 100 or 200 doses, and there's no way that we're going to be able to meet the immediate demand, and many people will be frustrated by not being able to schedule an appointment. We understand that our current online reservation tool has challenges. We are working to resolve those issues. We are in discussions with the state to gain access to their scheduling software system. However, regardless of the scheduling system, until supplies increase significantly, appointments will be limited. We will continue to let islanders know when reservations open through our website, on social media, and with local media press releases. We understand that it's frustrating, and we know that islanders are looking to get and want to get their vaccine as soon as possible. Our intentions are and hopes are, as vaccine supplies increase, this part of the process will be less aggravating for everyone. The simplest answer is we simply do not have the resources to handle the number of phone calls and emails that we would be required to sort, maintain, and to schedule the many thousands of people on a waiting list. We don't know when our vaccine is going to arrive until very late in the week. So we can't actually schedule appointment slots until we have this information, which really limits the amount of time we have to call and schedule from the list. In addition, our partners, the other healthcare providers and pharmacies, will begin receiving and scheduling their own appointments. This will only increase the complexity as people seek and obtain shots elsewhere. We have looked long and hard at every solution, and there's just not a good one that wouldn't pull our staff away from the work they're doing around case investigations, contact tracing, and vaccine delivery. We do want to highlight, however, that we are working closely with other partners in our community, including the resource centers and our own senior center staff on each island, to do direct outreach to and provide support for those islanders who do not have computer access, so that those individuals get the support they need to schedule an appointment. Getting the vaccine to each islander is our goal. We're asking all of you for your patience as we go through this process. We are making steady progress, and that progress will speed up as vaccine supplies increase. The ordering process is fairly simple. We submit a request to the State Department of Health early in the week, generally on Mondays. The State Department of Health has to compile all of the requests from around the state, look at their supplies, and determine who gets which allocation. They notify people towards the end of the week, generally on Fridays. The allocation is then shipped to the jurisdictions the following week. Like every other jurisdiction in Washington State, and probably in the country, we are receiving much less than we asked for. In regards to our distribution among the islands, we use a very simple process and is based roughly on the population of each island. We understand and we know there's a lot of frustration with the lack of vaccine supplies. We always knew that it would take time for supply to start rolling our way. Last fall, if you would have told us that over 1,000 islanders would have initiated their COVID vaccines by the end of January, we would have been delighted. We understand there's always room for improvement, but we are moving forward and islanders are getting vaccinated every week. I wish I knew for sure. I have no doubt it will increase over time. Other vaccines will be approved, though I think that even once approved, there will be a period of time until those vaccines start arriving in any quantity. Again, patience is key as we wait for supplies to increase. Know that those of us tasked with getting vaccine into arms are ready to go as supplies come in. We know this is difficult for everyone in many different ways. On behalf of all of us at San Juan County, I want to say thank you to the islands and the people who live and work here, to our healthcare providers, first responders, small business owners, schools, and other people working on the front lines. And I really want to thank the people on our team and everyone who is working to support this effort in any way, not just with vaccines, but with all of the good work that is happening. While this is far from an ideal situation, we're all very fortunate to be going through it together here in the islands. Thanks everyone. Stay patient, stay healthy.